The next clinical anatomy is about the radius, and we can see this is the radius and this is the ulna, and radius commonly gets fractured 2 centimeters above its lower end whenever there is a fall on the outstretched hand, and this is the proximal position of portion of the radius, and this will become the distal portion of the radius whenever this gets fractured here. And we can see there are two kinds of fractures. This is called as COLLES fracture and this is called as Smith's fracture. In COLLES fracture, this is the distal part. The distal part gets displaced upwards and backwards, and the radial styloid, this is the radial styloid, comes to lie proximal to the ulnar styloid process. Okay, we can't see here, but it can be seen. Ulnar process will be here, okay, distally, and I mean that side. And in the Smith's fracture, there is the distal portion of the radius gets displaced anteriorly and inferiorly. Okay, and this is the Smith's fracture and this is the COLLES fracture. Okay, next one is the subluxation of the head of the radius or pulled elbow, and in this what happens is whenever there is sudden jerk upwards, there is a dislocation of the head of the radius from the annular ligament. The annular ligament normally is present around the head of the radius, but when given a pressure upwards, there is dislocation of the head of the radius from the annular ligament, and this is called as pulled elbow or subluxation of head of the radius. Okay?